News release. Wednesday, March 29, 2023. Study findings support the continuation of providing telehealth services for opioid use disorder and its related care. The expanded availability of opioid use disorder-related telehealth services and medications during the COVID-19 pandemic was associated with a lowered likelihood of fatal drug overdose among Medicare beneficiaries, according to a new study. The results of this study add to the growing research documenting the benefits of expanding the use of telehealth services for people with opioid use disorder, as well as the need to improve retention and access to medication treatment for opioid use disorder, said lead author Christopher M. Jones, PharmD, Dr. Ph., Director of the National Center for Injury Prevention and Control, Centers for Disease Control and Prevention. The findings from this collaborative study also highlight the importance of working across agencies to identify successful strategies to address and get ahead of the constantly evolving overdose crisis. Published today in JAMA Psychiatry, this study is a collaborative research effort led by researchers at the National Center for Injury Prevention and Control, a part of CDC, the Office of the Administrator, and the Center for Clinical Standards and Quality, both part of the Centers for Medicare and Medicaid Services (CMS), and the National Institute on Drug Abuse, a part of the National Institutes of Health. CMS is committed to ensuring that the beneficiaries we serve can access the high-quality behavioral health services they need, said senior author Dr. Shari Ling, MD, Deputy Chief Medical Officer at CMS. This study shows that many beneficiaries were able to utilize opioid use disorder-related telehealth services during the pandemic, but we need to continue our efforts to broaden the use of telehealth, particularly in underserved communities. In this national study, researchers analyzed data among two cohorts of Medicare beneficiaries to explore receipt of opioid use disorder-related telehealth services, receipt of medications for opioid use disorder, and fatal overdoses before and during the COVID-19 pandemic. To do this, they compared data from two cohorts of Medicare beneficiaries across two time periods. The first cohort was constructed with data from September 2018 February 2020 and included 105,162 Medicare beneficiaries with opioid use disorder, the pre-pandemic cohort. The second cohort was constructed with data from September 2019 February 2021 and included 70,479 Medicare beneficiaries with opioid use disorder, the pandemic cohort. In addition, the researchers conducted an analysis to examine the demographic and clinical characteristics associated with fatal overdose in the pandemic cohort. Key findings of this study include: at a time when more than 100,000 Americans are now dying annually from a drug overdose, the need to expand equitable access to life-saving treatment, including medications for opioid use disorder, has never been greater, said Wilson Compton, MD, Deputy Director of the National Institute on Drug Abuse and senior author of the study. Research continues to indicate that expanded access to telehealth is a safe, effective, and possibly even life-saving tool for caring for people with opioid use disorder, which may have a longer-term positive impact if continued. Although the results of this study were able to identify the positive impact opioid use disorder-related telehealth services had on lowering the risk for fatal drug overdose in the pandemic cohort, the authors note that only 1 in 5 Medicare beneficiaries in the pandemic cohort received OUD-related telehealth services. Similarly, only 1 in 8 beneficiaries in the pandemic cohort received medications for opioid use disorder. These findings underscore the need for continued expansion of these potentially life-saving interventions across clinical settings. Find treatment for substance use disorder, including opioid use disorder. If you or someone close to you needs help for a substance use disorder, Talk to your doctor or call SAMHSA's national helpline at 1-800-662-HELP or go to SAMHSA's Behavioral Health Treatment Services. If you have questions about any medicines, call the U.S. Department of Health and Human Services Poison Help hotline at 1-800-222-1000 About CDC, CDC works 24/7 protecting America's health, safety, and security. Whether disease start at home or abroad, are curable or preventable, chronic or acute, or from human activity or deliberate attack, CDC responds to America's most pressing health threats. CDC is headquartered in Atlanta and has experts located throughout the United States and the world. About the Centers for Medicare and Medicaid Services, CMS provides health coverage to nearly 150 million people through Medicare, Medicaid, the Children's Health Insurance Program, and the Health Insurance Marketplace. A component of the U.S. Department of Health and Human Services, CMS, serves the public as a trusted partner and steward dedicated to advancing health equity, expanding coverage, and improving health outcomes. About the National Institute on Drug Abuse, NID, NID is a component of the National Institutes of Health, U.S. Department of Health and Human Services. NID supports most of the world's research on the health aspects of drug use and addiction. The institute carries out a large variety of programs to inform policy, improve practice, and advance addiction science. For more information about NID and its programs, visit https://www.nida.gov/. About the National Institutes of Health, National Institute of Health, National Institute of Health, the nation's medical research agency, includes 27 institutes and centers and is a component of the U.S. Department of Health and Human Services. National Institute of Health is the primary federal agency conducting and supporting basic, clinical, and translational medical research and is investigating the causes, treatments, and cures for both common and rare diseases. For more information about National Institute of Health and its programs, visit www.nagov. National Institute of Health turning discovery into health registered. Jones CM, Schaff C, Blanco C, Losby JL, Ling SM, Compton WM. Association of Receipt of Opioid Use Disorder-Related Telehealth Services and Medications for Opioid Use Disorder with Fatal Drug Overdoses Among Medicare Beneficiaries Before and During the COVID-19 Pandemic. JAMA Psychiatry, March 29, 2023. DOI 10.1001/JAMA Psychiatry 2023.310